It's a pleasure to speak here again, and I will be talking in the next 10 minutes about convergence of AI, XR, and Web3 and digital health. So these are my affiliations one more time. In addition to my academic and clinical work, I'm also a founder and CEO of PantridgeDTell, a company that's based in Irvine, LA, working on innovating resuscitation through medical extended reality and making the care of cardiac arrest patients better. In this presentation, the objectives is to define AI, XR, Web3, and probably every one of us now know what exactly the definition, but I see through clinician lenses and sub-lenses, and then try to find out the synergies between these three tech trees and touch base on artificial integrity, which is a relatively new terminology coming through our new life now. And at the end, we'll look at the new stakeholders and investors, how they see investment through this convergence, and how the healthcare system will move into a smart digital healthcare system. So this is a brief definition of AI that I like, which is the engine of care providing not only the driving force, but the computational power needed to achieve efficiency in executing tasks and delivering healthcare services without constant monitoring and reinforcement to function. And medical extended reality could be very much AI-driven, softwareized medical devices that transcend from 2D to 3D interactions between patients, caregivers, their families, and healthcare providers. And this is a very lovely word cloud that I like, that's highlighting the concept of tool, autonomous, evolutionary, embedded, and 3D complex technologies all together, leading into an innovative healthcare system in 3 dimensions, which are the predictive, diagnostics, and also predictions. Now, what is Web3? Literally, Web3 is the foundation, and it's the infrastructure that will enable all these technologies to function together in synergy. And so it will be fair enough to say it's the foundation that will make sure our data is private, secured, and it's also decentralized. So it's the foundation of Internet of the future, democratizing healthcare values online and decentralizing work with more security and patient control over their health data. Now, what is the AI integrity? I think it's all about the consent, the adherence to healthcare system value, and the most important value that we have here is do no harm to patients, which is defining patient safety through the new technologies. It's allowing us to be fairer, minimizing bias, and increase digital healthcare trust. So is it the new AI frontier? Yes, I think it is, and it's a complete this triad of technologies by creating rapid ethical deployment or personalized and dynamic digital health systems. And here we have 4 ways of integrating or understanding AI integrity, and for us in healthcare system, I think we will be focusing on the human first mode and the fusion mode, where humans are going to be really irreplaceable, and the role of AI and human interaction will continue to happen, especially through telemedicine. And this is a graph that I like, and it's done by Assil, and it's just highlighting every single detail that I just shared with you, and showing you a very new, a very little space here, which is the new reality, that we hope that it will go bigger and bigger, especially when we have blockchain as the backbone of this convergence and the transformation. And here we're going to have a little look at what the industry is doing so far. We're witnessing a holistic ecosystem AI-powered medical extended reality innovation in multiple clinical use cases, which is not limited to certain hardware, but it's actually inclusive to countless software as medical device in many clinical use cases. And that intuitively enhance inpatients and outpatients experience. And this is a graph here also done by Alex, summarizing cardiovascular healthcare companies and startups and what they are doing in terms of cardiovascular innovation. Now, speaking about academia is in the front lead, and they are leading the AI innovation in terms of the fact that they have the access to their big data and big registries. So on the education side, there have been already medical extended reality and virtual reality included in the medical curriculum for medical students and clinical trainees that has been proven cost-effective and many clinical scenarios. On the side of clinical research, we have already patients that has participated in clinical research, and they have precise computer interaction plus patient-provider interactions generating data. In addition to that, we have the clinical practice future, which is going to slowly transform into the visualization of a patient 3D scene, and that will be enabling us practicing minor and major complex procedures such as neurological surgeries and cardiovascular surgeries as well. And Johns Hopkins are already doing that. They are doing the neurological surgeries through medical extended reality. Now, hospitals, they are the stakeholders and they are the customers, and they are also the main collaborators with FDA regulations. So let's see what the FDA is saying and the barriers. CMS, the insurance, they have published something two months ago. They're saying that they want to cut off the payment for physicians in the healthcare systems. Probably they're looking for more cost-effective services. And that's true. So all 50 states, they signed a letter for a new legislation to ensure the sustainable physician payment in the future. So how are we going to ensure that in our smart digital health system? Maybe we need a new policy. That's true. And so FDA published also 2 months ago a new machine learning transparency principles plus transparency principles. And here we have 10. And the most important few things here, I see the good software engineering. They're highlighting that, very much important. Training the data and have enough data to be able to retrain the data, because generating AI will necessarily need us to be able to retrain the data as the data evolve. Human AI team is very important in terms of interacting with AI information. Selected reference data is also very important in the future, and who are the clinical study participants. Those are very important elements in terms of the convergence. Transparency principles. The time is so limited to dive into this, but I would just highlight the who, why, what, where, and when, and then at the end down is just saying how, and that particularly saying that the transparency should be reflected in each phase of the device life cycle. From the design all the way and the conceptualization all the way to the implementation, including patients and healthcare providers and engineering. Now, what are the new stakeholders saying? Those are 4 billionaires that have already invested millions and billions in AI technologies, and those are my favorite here. They like imagining. Also, this was published 2 months ago, and they like imagining that we're going to have a cheap virtual doctor on a smartphone. That probably we do. AI is going to be equalizer, and the existing risks are not existing. Those are the words of the stakeholders and the investors. And also, we need to regulate early. So if not, we're probably going to generate dangerous data. And finally, AI will prevent disease and early mortality. So the stakes couldn't be higher. Now, what is the convergence? It's not only a technological advancement, but it's a fundamental shift in conceptualization, continuing engagement between present and future healthcare system. So the healthcare system now is limited, controlled, centralized, overbooked, and probably patients are not very satisfied. But what we can do in the future is owning our digital assets as patients. And so that's what Alex just talked about. The new system will be decentralized, autonomous organizations, that's the convergence, dependent on 4 pillars, which is information, human resources, management, and finance. So for the information, we're going to deal with the new data, big data, something that's evolving. It's not just coming from the past. And the management here is just looking into novel ways of managing these data through AI, medical extended reality, and decentralization, blockchain, Web3, as well as a fundamental framework. For the human resources, that's we will be always and forever responsible about cleaning, generating, and curating that data. And the finance, we will be looking into new novel pay-per transactions, and also making sure that our healthcare services are still accessible, affordable, and sustainable to our patients. Now, 6 challenges. It's also very hard to dive into all the details here, but scalability is one of the very, very important challenge that we're facing throughout this convergence. Scalability means taking care of the data, in another word, and then also also privacy and data protection, accessibility and interoperability, governance of the data, and finally, which is the most important part here, the clinical acceptance by stakeholders. So in order for us to be able to achieve a successful convergence, we have to have the stakeholders on our side, and CEOs, physicians, and all the healthcare system approving that clinical implementation. So what is convergence? It's a state of digital trust, and it's all of the above of what I just talked about. And my message to the audience: be alert, be vigilant, and be proactive. So we're expecting a verifiable, robust, immutable conditions in our system, and the benefit will be increased revenue, increased patient satisfaction, timely, accessible healthcare service, and less burnout for physicians and healthcare staff. And this is just a message for you to have a look at our Journal of Medical Extended Reality, founded by Brian Spiegel, who is my current program director at the Masters of Health System Sciences, Cedars-Sinai, together with Rohan Rutwani. And this is a tweet that was done just 48 hours ago, talking about the future of medical extended reality. So follow us on Twitter, and please reach out to me. I'm very active on LinkedIn and on my Twitter as well, and to my email. And that's the final word: move together inclusively and responsibly. Thank you for attending.